Sniffer dogs in cancer detection, a One Health approach. This is an audio summary of the article, The Use of Sniffer Dogs for Early Detection of Cancer, a One Health Approach. Introduction. Dogs possess a remarkable sense of smell, estimated to be 100,000 times more sensitive than that of humans. This exceptional olfactory ability has led to their use in various fields, including locating drugs, explosives, and cadavers. More recently, the potential of scent detection dogs, also known as sniffer dogs, in healthcare is being explored. They have been trained to detect a variety of diseases in both humans and animals, including seizures, hypoglycemia, viral and bacterial infections, and various types of cancer. This review article focuses on the current research surrounding the use of sniffer dogs for disease detection, particularly in the field of oncology. It highlights how advancements in this area can benefit both human and veterinary medicine, exemplifying the One Health concept. The basis for canine detection of various diseases lies in the presence of volatile organic compounds (VOCs). These compounds are produced by an individual's immune system in response to illnesses, including endocrine, inflammatory, and neoplastic diseases. VOCs are unique to each disease and can be found in various bodily fluids like breath, urine, blood, and colon contents. Dogs, with their highly sensitive noses, can discriminate between these VOCs even at extremely low concentrations, as small as 1 part per trillion. This review will discuss the use of sniffer dogs in detecting various cancers in both humans and animals, emphasizing the potential for early disease detection. Human cancer detection. Research into using dogs for cancer detection began with anecdotal reports of pets alerting their owners to skin cancers. Building on these observations, scientists have investigated the use of dogs to detect differences in samples from human patients with various cancers over the past 2 decades. A systematic review encompassing 226 dogs participating in disease detection projects revealed that 68% of the studies focused on cancer detection, with lung, prostate, and breast cancers being the most common. Various sample types, including breath, sweat, saliva, urine, fecal matter, and blood, have been used in these studies. Lung cancer, study by Kara et al. 2019. 4 beagle dogs were trained using serum samples from patients with non-small cell lung cancer (NSCLC) and healthy controls. In double-blind testing, the dogs exhibited high sensitivity, 96.7%, and specificity, 97.5%. In detecting lung cancer, study by Phil et al. 2021, after a year-long training program, a sniffer dog successfully detected lung cancer in both breath and urine samples with an overall detection rate of 97.6%. Study by Liu et al. 2023. 6 sniffer dogs demonstrated higher sensitivity and specificity in detecting lung cancer from exhaled breath compared to urine samples. Interestingly, training with breath samples led to higher detection rates than training with tumor tissue samples, suggesting that VOCs may be better preserved in breath. Prostate cancer, study by Gordon et al. 2008. This study, where pet dogs were trained by their owners to detect breast or prostate cancer in urine samples, did not yield results better than chance. This highlighted the importance of rigorous training and testing protocols. Studies by Taverna et al. 2015, Urbanova et al. 2015, and Cornu et al. 2011. In contrast, these studies reported high sensitivity and specificity, over 90%, in detecting prostate cancer in urine samples using trained sniffer dogs. Study by Taverna et al. 2015b. Trained dogs, initially trained for explosive detection, could detect biochemical recurrence of prostate cancer in urine samples after radical prostatectomy. The dog's detection correlated with the patient's prostate-specific antigen PSA levels. Breast cancer, study by McCulloch et al. 2006. 5 dogs accurately detected breast cancer from breath samples with 88% sensitivity and 98% specificity. Notably, the accuracy was consistent across different stages of cancer. Studies by Thulo et al. 2019, and Cura et al. 2021. These studies demonstrated high sensitivity, 90.3 to 100%, and specificity, 100%, in detecting breast cancer using skin secretions and urine samples, respectively. Study by Sayo et al. 2018. This study explored whether dogs trained on one cancer type could detect a different cancer. 2 dogs trained on murine mammary carcinoma cell lines could successfully discriminate samples from murine colorectal carcinoma cell lines, and vice versa. This highlighted the potential for cross-detection capabilities in sniffer dogs. Studies in veterinary patients. Following the promising results in human cancer detection, researchers began investigating the potential of sniffer dogs in benefiting their own species. Canine cancer, study by Dorman et al. 2017. This study evaluated the feasibility of sniffer dogs in detecting canine urinary transitional cell carcinoma using urine samples. While 1 dog successfully completed the training program, it could not accurately identify the positive tumor samples during the final evaluation. This negative result was attributed to various factors like medication interference, sample preparation, and the training regimen. The authors also acknowledged the possibility of pheromones in the urine samples interfering with cancer detection. Study by Malone et al. 2023. This study, conducted by the authors of the current review article, assessed the ability of trained dogs to discriminate between saliva samples from dogs with cancer and healthy controls. Study design. Black small square saliva samples were collected from 139 dogs with various cancers, sarcomas, lymphoma, mast cell tumors, melanoma, and carcinomas in 161 healthy control dogs. Black small square cancer diagnosis was confirmed by histopathology, cytology, and relevant ancillary testing. Black small square. All samples from cancer patients were collected before any treatment. Black small square samples were stored and transported under controlled temperature conditions to preserve VOCs. Black small square 6 dogs were trained using positive reinforcement methods to distinguish between cancer and control samples. Black small square figure 1 depicts the 6 dogs undergoing training. Black small square supplementary video S1, not provided in the excerpt, showcases the training process results. Black small square table 1 summarizes the results, demonstrating the high accuracy of the sniffer dog team in discriminating between cancer and healthy samples. Black small square. The mean sensitivity for all dogs was 90%, with a range of 80 to 100%. Black small square. The mean specificity was 98%, with a range of 91 to 100%. Black small square. Both positive and negative predictive values were 95%. Feline cancer. The authors are currently conducting a similar study focusing on feline cancers, including squamous cell carcinoma, mammary carcinomas, sarcomas, and lymphomas. This research will further evaluate the ability of sniffer dogs to differentiate between specific tumor types and stages, and how treatment impacts scent detection. Future directions. The preliminary research presented in this review strongly suggests that canine scent detection can significantly contribute to the health and welfare of both humans and animals. However, further research is crucial to optimize various aspects of this approach, including dog selection and training, identifying specific breeds or individual dogs with exceptional olfactory abilities, and developing standardized training protocols, sample sourcing and storage, establishing optimal methods for collecting and storing samples to preserve VOCs and minimize contamination, training and testing protocols, ensuring dogs discriminate based on odor rather than memorizing specific samples, and refining training methods to enhance accuracy and reliability. VOC analysis, utilizing techniques like gas chromatography, mass spectroscopy to identify specific VOCs associated with different diseases, potentially leading to the development of electronic noses for disease detection. The promising results achieved so far indicate that sniffer dogs can detect viral infections and cancers rapidly and with high accuracy. While the integration of sniffer dogs into clinical settings may face regulatory and logistical challenges, one can envision their use in disease screening, either directly in clinics or by screening samples collected from patients at home or in clinics. Regardless of how their utilization evolves, sniffer dogs have demonstrated their remarkable potential as valuable tools for public health protection. Further research and development in this field hold immense promise for improving disease detection and ultimately enhancing the health and well-being of humans and animals alike. From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.